Did you forget it was me?
Obviously, this one's right.
I was setting him up for being tidy there.
Preparing them for you.
No, for Danny.
It was Mark Bailey.
Yes, I just pointed the microphone a bit better. Thank you. Good, thanks.
Okay, let me know when we're good to go. Good. Well, good morning, Queensland. With wonderful news, 0 new cases today, and we are currently down to 4 active cases in Queensland. This is astonishing, and it's a result of the great work of all Queenslanders doing the right thing, making sure that they're staying safe, coming out and getting tested, and of course all those people home quarantining. And I can advise that we've got 2,243 people who are now home quarantining who have come from interstate, both Queenslanders returning home and also people choosing to relocate to call Queensland home. Now, we did 7,018 tests in the last 24 hours, which is great to see people still coming out and getting tested. Again, doesn't matter where you live in Queensland, if you have any symptoms whatsoever, we want you to come out and get tested. We did 14,992 vaccinations in our Queensland Health facilities yesterday, and our schools run by the Queensland Health facilities and some of our partners saw 3,922 vaccinations in schools yesterday, and that's probably over 4,000 with some of the other providers still to give us their numbers. 52% of those are first doses, and that is fantastic news to see so many people still coming out and getting their first dose. That puts us at 84.35% first doses and 73.06% second doses. So we are certainly getting up there, but we want people to keep coming out and getting vaccinated, and that's why if you haven't been vaccinated yet, whether you're due for your second dose or you haven't had your first dose yet, we have many schools across Queensland open today. I'm here at Morayfield State High School with Minister Mark Ryan, the local member for Morayfield, and we want to encourage people to come out and get vaccinated. A number of our schools also have sporting celebrities there today from about midday, so please pop along, say hello to your favourite celebrity, get a photo and get a jab. Because we know it will keep everyone safe. And I want to give a shout out to the community here at Morayfield because they've had an almost 5% increase in the last week. So 4.92% increase in the last 7 days. So that is fantastic. Keep it up, keep coming forward, getting the jab, and of course, making sure you're staying home when you're unwell, getting a test if you have any symptoms whatsoever. And if you're in big crowds or you feel like you can't socially distance, of course, don't forget to have that mask on you and put that on where you think you need it. I'll ask Dr. Peter Aitken now to say a few words, and then Minister Mark Ryan.
Thank you, Minister. As you've heard, 0 new cases in Queensland today, which is just wonderful news. Most importantly, that means 0 new cases in Gold Coast, Gundawindi and Doomadgee, the areas we've been watching closely. And the closer we get to that 14-day incubation period without cases, the better it is for Queensland. Most importantly, the vaccination rate continues to go up. As you've heard, we're getting closer and closer to 80% double vaccinated, and that's such an important milestone for Queensland. I think the message remains the same, and as the Minister has said, if you've got symptoms, particularly in those areas where there are extra interest, please come forward and get tested. And if you haven't been vaccinated yet, please come forward and get vaccinated. Or if you've had your first one, don't forget about your second. The sooner we can get to 80%, the better. Thank you.
Thank you very much, and I know that there's a bit of live streaming happening at the moment, so to everyone watching at home, hello. Welcome to Morayfield, I think one of the best places in the world, so I'm glad you could be joining us here in Morayfield this morning. Firstly, a shout out to the Morayfield community for increasing that first dose vaccination so much in 1 week, up almost 5%. Well done. Keep it going, keep the momentum up, and also for those people who have had your first dose, make sure you book in your second dose so that you can be fully vaccinated in time for the 17th of December when we have those vaccinated only venues come into play. Secondly, I've got two boys. Both of them are under 12. So they're relying on the community to be vaccinated. Oh, here's one now. Hello, Danny. Danny and Flynn are relying on the community to be vaccinated. There are tens of thousands of kids out there who can't be vaccinated yet. And they're relying on me, they're relying on you, they're relying on every single Queenslander to be vaccinated, because we know if you're vaccinated, you're less likely to transmit the disease. It's really important for kids that adults in our community are stepping up to keep them safe. So encouraging everyone, continue the momentum. We're doing so well. There's so many people getting vaccinated. Do it for the kids, get vaccinated. Do it for yourself and your loved ones. Do it for Queensland. I encourage you all to get vaccinated today.
Questions?
Minister, health experts are calling for the government to remove the requirement for COVID tests at 80% for returning travellers or travellers wanting to enter the state. Will you drop it or change the test to a rapid antigen test when you hit 80?
We are not removing the requirement to have a test at the 80%, because we have to remember that still means 1 in 5 eligible Queenslanders 16 and older are unvaccinated. And we've just heard from Minister Ryan making a very important point here. We have children under the age of 12 who are not vaccinated, cannot get vaccinated yet. We have our 12 to 15-year-olds that are around 60% vaccinated now, first doses, but they don't have the full coverage. We have to make sure we're still making sure we protect that community. We've also seen what's happened overseas, where many countries have opened up fully at the 80% double dose rate and ended up having to go back to quite strict restrictions only a matter of weeks later, because they had big outbreaks. So at 80% double dose, we are not at that rate that we can say we don't need anyone tested. We need to make sure we do this in a safe, responsible way. Our plan has been outlined. We're sticking with that plan. As far as what tests people need to undertake, we will take the advice of AHPPC and our health officers here in Queensland in advising what tests should be taken. We don't want to swap tests just because one might be cheaper. We understand that it comes at a financial cost for people interstate to have to go to a private pathologist to get a test. And I think this is something that the Morrison government should seriously consider, whether they should be heavily subsidising these tests so that people can move around our country more freely.
PCR tests are already covered by Medicare. The only reason why you're going to private pathology and you have to pay for the test is for a travel clearance.
Yes, but the Commonwealth can change that. The Commonwealth can change on what terms the Medicare rebate can apply. It is then in their hands. We have no control over that. We don't regulate that part of the sector. We certainly are not responsible for Medicare. So it is in the hands of the Commonwealth as to whether they want to expand the subsidy, which I think would be sensible in the current environment where we want to see people getting tested. It shouldn't be a matter of whether someone can afford it or not, as to whether someone gets tested so we know if people are moving around our country positive or not. That should be, this is a health-led response. It always has been. And the economic response should follow from that. So this is something that the Morrison government should seriously turn their mind to.
Or the Queensland government could say that you could take a rapid antigen test. The roadmap outlines that it's a PGA-approved test. There are multiple rapid antigen tests that have now been approved by the PGA. They're selling at Chemist Warehouse for $25 for a pack of 2. Why doesn't the Queensland government just say, yes, we will accept rapid antigen tests? Other states and territories are already doing that.
Because we also know that the PCR tests are more accurate, and we are in a different position to New South Wales, Victoria and the ACT. New South Wales is still recording over a couple of hundred cases a day. Victoria is still having over 1,000 positive cases a day. We are not in the same position as them. They can be more relaxed because they already have the virus throughout their communities. So they're not trying to suppress the virus like we are. The fact is we have 4 active cases in Queensland. We are in the best possible position to prepare ourselves when this virus comes, and it will be coming in a matter of weeks when we hit that 80% double dose. So we have a responsibility to keep our community as safe as possible while we open up, while we allow more people travelling directly from hotspots into Queensland, and we need to do that in the best way possible. Now, if the health advice here in Queensland is we can start shifting to some of those rapid antigen tests sooner, then we'll take that advice. But at this stage, we are going to allow on the PCR test, because if someone was to get a positive test on a rapid antigen, they're then going to have that verified by a PCR test anyway, which would lead to delays. So we believe the most efficient way is to going and getting the PCR test. But we shouldn't be choosing which test based on cost. It's something that the Morrison government can rectify.
It's obviously a question of balancing the health of Queenslanders versus the economy, though, because basically by taking a PCR test, you're killing off day trips over the border, and you're affecting the tourism economy over the busiest period of the year.
Well, at the 80% mark, what we have said is that this is about getting Queenslanders to be able to come back home, including by road, and we know there's many wanting to come by road into Queensland and people wanting to relocate here. We understand that doesn't mean everyone's going to be able to travel freely without testing and all of those things at the 80% mark. Why? Because we don't have community transmission happening in Queensland right now. We cannot just lift all of the restrictions and say everyone can move around when 1/5 of our eligible population are still unvaccinated at the 80% mark. We need to get higher before we consider that.
Minister, why are overseas born spouses and the children of returning Australians born overseas being forced to stay in hotel quarantine?
We have outlined our roadmap as far as transitioning for international arrivals. We will follow that roadmap so that we don't have the virus coming in, both internationally and domestically, all at once. We have to have a measured approach, a responsible approach in this virus coming into our community. When we talk about the best thing to do for businesses and the busy Christmas period, the most important thing we can do for those businesses is give them confidence that we're not going to have widespread transmission happening across Queensland at their busiest time. So we do that by having a very measured and sensible approach.
What's that got to do with someone being double dosed and someone being born in Australia and being born overseas? Or do they carry the virus differently?
Well, whether you're born overseas or whether you are born in Australia, we're not treating you differently at this stage. We're saying you have to hotel quarantine if you're an international arrival because we need to make sure that we're keeping the community safe. And we've had many cases in the last few weeks where people have arrived internationally into Brisbane and have tested positive on day 1 or day 2. So people are still arriving with the virus, and it would be irresponsible for us to say those people can go straight out into the community at this stage.
But that changes at 80%, does it? Sorry.
Well, we've laid out our roadmap as far as the international and domestic arrivals and when people can quarantine, and people being able to quarantine at home at that mark.
The Northern Territory, which is currently in a COVID-19 outbreak and arguably has the most to lose in a big outbreak in terms of human life, is moving to 7 days of home quarantine. Why isn't Queensland moving to 7 days of home quarantine?
Well, I would disagree with the comment that Northern Territory's got the most to lose as far as human life. Every human life is important. So to say that theirs is more important than Queenslanders, I don't think so. We've got 5 million Queenslanders to be responsible for, including our First Nations people. So we take that very seriously. Our roadmap, we believe, is safe, it's responsible, and it's based on the best health advice.
What's your reaction to this news that threatening emails are being sent to federal and state Queensland MPs?
Oh, look, it's disappointing. We don't want to move to a state and a country where politicians can't speak freely and move freely around our communities. It's one thing that Australia has always prided itself on, whether it's elections and change of governments, these things happen smoothly without riots in the streets. That's been an amazing thing for our democracy in Australia, one we've been extremely proud of. And I am concerned about some of the rhetoric, some of the threats going around. I do think that people need to be very clear in their language to not be inciting or not to be encouraging this sort of behaviour.
Are you concerned that the protests are being sort of infiltrated by some of these far-right extreme groups like Proud Boys and Reclaim Australia?
Look, we support people having the right to protest in Queensland. You do it in a responsible, respectful way and in a way that you are not putting other people's safety at risk. That's what we ask for, but would never ever condone a situation where people are encouraging or inciting violence in any way whatsoever.
Have you been the target of any of those threats yourself?
I have.
Can you elaborate on that?
No.
Obviously you don't normally travel with security, and security here today, is that how serious you're taking it?
We have to take it seriously, We've all got to make sure that we can get on with doing our job and do that in a safe way and, keeping our family safe as well. So it's disappointing that we have to do it, but, it is part of the job.
Is it a little unsettling to you? I mean, you're a very democratic person, obviously, yourself, and this is a democratic country. To be under death threats would be quite unusual
Look,
on a day-to-day basis.
Yeah, and look, we know what others have had to go through, what the Premier and the Chief Health Officer, the former Chief Health Officer, went through last year with some very serious threats. We've seen it interstate, we've seen it with other Premiers, other health officers, health ministers. It is disappointing, but we'll just get on with our job.
Do you feel safe in your role?
I do. We've got one amazing Queensland Police Service who do a terrific job in this state, and also nothing's going to stop me doing my job. I love what I do, and my role is extremely important. I consider it a privilege and an honour to do my job, and I'm just going to get on with it.
We've seen that tool look up a couple that's having to home quarantine. They can't get any electricity whatsoever because Ergon refuses to go there because they're under a 14-day COVID quarantine. Is that a bit crazy that people can't get electricity in their own home?
Look, we're working with the electricity providers. We've got 3 households that have moved to Queensland and not had the power organised ahead of time. We do ask people who are relocating, we've specifically said, please make sure your homes are ready. You're equipped with food for the 14 days, with all your furniture, with everything you need to live in that home for those 14 days. But we are working with the electricity providers. I'm confident we will be able to find a resolution to this, that they can be confident that their staff can do their jobs safely, but that we can also get electricity provided to these homes.
Nice. Minister, Minister, obviously the press over with Bailey at the moment about the seatbelts and mobile phone cameras. Your thoughts on that? I imagine you've seen the figures. Are they quite high? Are you discussing by people's behaviour on the road still, even after you've rolled out the cameras?
Yeah, so we've had that period of a trial where we tested the technology, but also issued, compliance warnings to people who were caught as part of that trial, and the numbers are quite astonishing. I can't believe that after 40 years of ramming home a message around people wearing seatbelts, that still in about 25% of all fatalities, the dead person hasn't been wearing a seatbelt. Like, it's been decades and decades of reinforcing that. It's the sort of the message you first learn from your parents when you get in a car, put your seatbelt on. So I can't understand for one moment how so many people are still not wearing seatbelts. Well, they're going to be caught out now because of these cameras. Infringement notices will be issued. But also, we know how dangerous driving while distracted is. So these cameras are going to catch that, and Queensland has the highest fine in the nation, $1,000. So people are going to learn pretty quickly that you can't do these dangerous things and think you're not going to get caught, because you will.
Minister, were you the subject of any threats as well, similar to what the Health Minister experienced?
Look, I won't go into that other than to say, I've been in this role for many years now, and from time to time, being in this role, attracts the attention of people who aren't necessarily the most upstanding citizens. But I feel very safe in my role. I don't just say this because you'd expect me to say it, but we actually do have one of the best police services in the nation here in Queensland. One, because they're very experienced around protecting dignitaries from big events. They did G20, they've done overlays with APEC, they've done the Commonwealth Games. So we've actually got very experienced as well as well-trained police here in Queensland. But also, the vast majority of Queenslanders are upstanding citizens. They're respectful about the political process, they're respectful about democratic processes, and they... Oh, thanks very much, mate. Yeah, very good. Okay. My son just got a lollipop, which is good. Lucky he likes candy. But our police service are very, very good. They look after us, and citizens broadly are very, very supportive of the democratic process and very respectful about it.
There was a death at a Central Queensland mine this morning. Do you have any more information on that?
I'm sorry I don't have that, but I'm sure we can find the information you need.
Just back to the threat, so are you concerned about this escalation that we're seeing?
Look, I think it goes without saying that we have seen an escalation in the intensity of threat. There are a very small cohort of people, I think, who are trying to hijack quite legitimate protest activity. Very small cohort. And I say to the legitimate protest out there, you've also got a responsibility about, you know, the conduct at the gatherings you organise. You've also got a responsibility to the broader community to ensure that those people who are attempting to hijack your democratic process don't use what you want to do for a lawful purpose for, you know, something which could quite seriously escalate into something which is very concerning.
Have you had
Last question.
briefings? Have you had briefings from or by the AFP or with your federal counterpart, Minister Fernandez, on the violence and on the protest?
Oh, look, I'm not going to go into specifics, but I get briefings very regularly from the Commissioner as well as others around processes that we've got in place, but I also get strong assurances from those people that we've got very good processes in place to keep Queenslanders and more broadly all citizens safe.
Just one to you, Dr. Peter Aiken. I know you're the last question. My last question. Dr. Aiken, you're the acting show. Rapid antigen tests, could they not work at 80%?
Rapid antigen tests work best when there's a high prevalence of COVID in the community. Queensland doesn't have that. And the advice from HPPC and the advice from all those who've used them is they've introduced them with benefit when there's been high numbers of COVID in the community. To put it very roughly, rapid antigen tests are about 70% as effective as PCR. The stage we're in, with 4 active cases, we want to identify every case, not miss 30%. So we'll continue to use PCR tests at this stage.
In layman's terms, why are they ineffective at a low rate?
Because they detect they need a higher level of circulating virus to detect it. So you miss the early stages of disease and the later stages of disease, which means you don't detect COVID in people until they're much further into disease. And it's the early stages we need to pick up.
So if you're still acting show at 80%, you won't be advising any changes in PCR tests?
It's not about the 80% vaccination rate that we'd use them, it's when we would have high numbers of COVID in the community. Victoria, for example, has over 1,000 cases today and they're using RAT tests, and that's a much better use of RAT tests than where we are with 4 cases today.
Has Acting Chief Health Officer, have you received any threats yourself?
Not personally, but that's good news for me.
Thank you.
Oh, just one last question. Do you know when the last time it was that we had so few active cases?
It's some time ago, and I'm amazed, I'm surprised. It's just wonderful that Queensland has complied and done all the things we've asked them as far as social distancing, wearing masks, people have gone out and get vaccinated, they've followed the border restrictions, and it's a testament to the work of our public health units and clinical staff as well, that they've identified people in the Queensland community has come forward and got tested. It's amazing and puts us in a great position moving forward.
Thanks, gotta go out. Thank you.
Thanks, everyone.